and I'll tell you a little bit about this area. This is where you check in for any specialty doctors' clinics that come, or as you come in for labs or x-rays or any of that type of thing. And this is where Jenny and I will be helping you with that, and Joni will be in this area where the nurses will be for the specialty clinics. There's a doctor dictating room back here, a beautiful waiting room that we can see outside and see how lovely the day is. And then Carol will show you the chemotherapy rooms. And
Joni will show you the little doctors or the
family
room. Joni can tell about that, then I'll take you through these rooms.
So we got to get about 12 to 15. Where's that?
Yeah. My name is Carol Blowbaum. I'm the oncology nurse here, and currently we don't have a designated area for giving chemotherapy. So if you had to come in, we would just put you anywhere, and now we have 2 designated rooms.
This is the family waiting room for the doctors to have private conversations with patients and their families after a certain procedure or an emergency.
Okay, the area we're currently in is the existing outpatient area. For those of you that have used the outpatient, there, right down there is the reception area. All that area down at that end and most of this area on this side is going to be remodeled. The current ER is right here. That will continue as an ER, as a backup ER, probably for some of the more minor type things, the lacerations and those types of things. What we're going to end up doing is we'll still utilize this side for outpatient. Of course, as they explained, the new outpatient reception and admitting area is right back there. We still have these 4 rooms that we currently have will be utilized as outpatient. The other side, like I said, will be partitioned off, and then there's demolition that will go on that side, the minor procedure room, and both waiting areas, and part of the reception area. Those will all become new outpatient exam rooms. So we'll be going from 4 to 8. We'll double the capacity of our outpatient exam room. As soon as they have that finished, and they'll partition this side off, very little demolition on this part. This will just be simply putting in new flooring, new wall covering to match the other side. And that's going to be about a 6 to 8 week project. Again, we'll still be able to utilize this area, but like I say, about 6 to 8 weeks, and then we'll have this part completed. Okay, we'll head this way. What we have, this is the women's locker room and men's locker room. They're identical. So what we're going to do is we're going to go through the men's locker room, which will take us through a sleeping room for the physicians now, which they never had before, in case of like an OB, or if they have a critical patient, they'll have an area where they can actually sleep, which they never had before. So we'll go through this locker room, through the sleeping room, and then we'll end up in the physician lounge right over here. This is the sleeping room for the physicians.
Doctor's lounge. Doctor's lounge, is that right?
And this is the new physician's lounge. The one they have currently is about a third this size, if that. Well, it's about the size of that area right in there. But now they'll have an area. Back here is a workstation. They'll have computers. They'll be have some dictation capabilities back here. Of course, refrigerator and a microwave. The current doctor's lounge isn't even big enough to get all 4 of our physicians in at the same time. So this will give them an area that they can come and, like I say, just relax or actually do dictation, paperwork, those kind of things. We're entering the surgical area right now, not the sterile. The sterile area will be past those doors, but this is coming into the surgical area. There's a linen storage. That's a housekeeping closet over there. But this room right in here, that's the surgery director's office. The surgery director's office, Irma's office now consists of the office, the nurse's lounge, and the locker room. So, and it's not even as big as this room. So now we have all three of those separately. So this is her office. This is the anesthetist workroom in here. You can see there's some table and chairs, and they have a microwave and a refrigerator and that type of thing back in here. The area we're going into now is central supply, and there's surgery personnel in here that will explain everything that's going on in there.
This is central sterile processing, what we're going to call it. Right here is a dirty utility room. And in here is where all the instruments that are used throughout the hospital, when they are dirty, they come into this room. We've got some openings in here, and that's because we've got some stainless steel sinks that we're going to be utilizing from our old area. They're still perfectly good. So when we do our final move, it's going to have to be kind of a quick thing, but we'll be filling in some of the spots here with some of those stainless steel sinks. Also, some of our other equipment, like an ultrasonic cleaner for smaller things, will be in here. This little area right here is for small micro instruments that we have to hand clean that cannot be processed in a bigger, the decontam. So we needed that area so that they could pass through. This is like a, basically like a giant dishwasher, and it's called a washer decontaminator. That means when they come out of there, they're clean, they have reached a certain temperature that if we wanted to, we could handle them without having any gloves on, if we wanted to. We probably won't. The counter space and covered space that you see here is probably now 4 times what we have, what we're working with. So once the instruments are clean and they pass through, we can put them on our counter space right there. We will wrap them in the appropriate wrappers or put them in their pans that they need to be before then they go to the autoclaves. And Beth's going to tell you about the autoclaves.
Down here we'll have 2 large autoclaves. We have one installed already. The second one we're currently using in our old area. We'll be able to sterilize almost twice as many instruments at one time as what we have now. We also have a small autoclave that we're currently using. We'll also be installing that in a sub-sterile area in between the operating rooms so we can flash sterilize something if needed. And you'll see that further on. The instruments from here, we'll bring those down to our sterile storage room further on down the hall, or into our actual operating rooms or their designated areas. So that's what we do in this room.
This is one of the 2 new OR suites. This is the larger of the 2. This is a little over 600 square feet. The one we currently use is around 300 square feet. So this is twice the size of the current one. And Lori, she's surgery nurse here, and she will explain what goes on.
Thank you. Like we said, this one is the larger of the 2. This is where we will be doing our orthopedic surgeries. We have larger space, larger areas. We do have lots of equipment, supplies that we have to have open for our knee replacements or orthopedic surgeries. 40% more storage in both OR rooms than what we currently have in our one OR, so that is wonderful. It's all stainless steel. It can be wiped down with our disinfectant. Also back there is an area where we can set our charts out, our forms, so we can do our charting, or the surgeon can do his charting or whatever we need done.